You sit in your car after work and you don't move. The engine is off, the radio is off, you're not crying, you're not doing anything. You're just sitting there because you don't have one more ounce of pretend left in your body to carry through your own front door. You smiled all day. You answered every message on time. You made eye contact when people talked to you, even though it felt like staring straight into a light. You laughed at the right moments. You said you were fine every single time someone asked, even though your head felt like 6 tabs open at once and none of them would close. And now you're sitting in a parking lot with the engine off because that performance cost you everything you had left for the day. If that's familiar to you, I need you to keep listening, because what I'm about to tell you isn't about being tired. It isn't about being a little anxious or a little disorganized. It's about something that has probably been misread about you for most of your life. A lot of women are walking around right now with ADHD or autism that nobody ever caught. Not because they didn't show signs, they showed plenty of signs, but because almost everything doctors were trained to look for came from watching boys. For decades, the research that built the diagnostic criteria for both ADHD and autism was done mostly on young boys. The list of symptoms in the textbooks came from boys who couldn't sit still, boys who interrupted, boys who lined up toy cars instead of playing with them the way other kids did. So when a girl showed up with the exact same wiring underneath, nobody recognized it because she wasn't climbing the walls of the classroom. She was sitting quietly in the back, finishing her homework late at night after everyone else was asleep, staring out the window, and somehow still managing to look fine on paper. That right there is the first reason so many women get missed. The criteria were never built with her in mind to begin with. Here's what almost nobody tells you about girls who grow up like this. They learn to copy. From a very young age, girls get a much heavier message to fit in, to be easy, to be likable, to not cause problems. So when something in her brain made her different, she didn't get to just be different out loud. She had to learn to hide it. She watched the other girls and copied how they talked. She rehearsed conversations in her head before she ever had them, just so she wouldn't say the wrong thing. She practiced eye contact even though it never felt natural, because she learned early that not making it made people look at her strangely. She built a version of herself that could pass. That's called masking, and it is exhausting in a way most people cannot picture unless they've lived it. Picture performing a role every single day, all day, every interaction, and never getting to put it down until you're alone behind a closed door. Eventually, that performance starts to crack in places she can't control anymore. She forgets a word mid-sentence in a meeting and has to laugh it off. She cries in a bathroom stall over something small, because the small thing was never really the problem. It was just the last drop in a cup that had been filling for years. She cancels plans at the last minute, not because she doesn't care about the people on the other end, but because she physically does not have anything left in her to give that day. That exhaustion is exactly why so many of these women end up in a doctor's office describing anxiety or depression or burnout. And the doctor treats the anxiety, the doctor treats the depression, because that's what's visible on the surface. Some of these women get told it sounds like borderline personality disorder because their reaction to overwhelm looks intense to someone who has no idea what sensory overload actually feels like from the inside. Some get told it's just generalized anxiety and sent home with a pamphlet. Some spend years on medication for something that was never actually the root of it. Nobody stops to ask why a grown woman is this exhausted from simply existing around other people. So she gets handed a prescription for the anxiety. And the actual thing underneath it, the ADHD or the autism that's been there her entire life, never even comes up in the conversation. There's also a reason this tends to surface later in life for so many women, and almost nobody talks about it. Hormones play a much bigger part in this than people realize. Puberty can intensify it. Pregnancy and the months after having a baby can intensify it. And perimenopause, when estrogen starts dropping, often pulls the cover completely off a system she's been quietly running for decades. The coping strategies that used to work stop working, and what was underneath the whole time finally becomes impossible to hide anymore, even from herself. Now let's talk about what this actually looks like day to day, because I want you to really see it and not just hear the words go by. With ADHD, it's rarely the version you see in movies. It's not always running around a room. In a lot of women, it looks like sitting completely still while her mind is somewhere else entirely. She's read the same paragraph 5 times because the words won't stick. She loses her keys, her train of thought, mid-sentence, in front of people who are waiting for her to finish. She can focus on something she loves for 6 hours straight and then completely fall apart trying to focus on paperwork for 6 minutes. People call that lazy. People call that flaky. Nobody calls it what it actually is, which is a brain that handles attention in a completely different way. With autism in women, it often doesn't look like what people expect either. She's not avoiding eye contact in some obvious way. She trained herself to do it because she had to survive socially. Her special interest isn't trains or numbers. It might be true crime, or horses, or a specific decade of history, or organizing her bookshelf by color. Things normal enough on the outside that nobody ever questions them. But underneath that, the tag in her shirt feels unbearable against her skin. The lights in the grocery store make her feel like her whole body is buzzing. A last-minute change in plans can ruin her entire day in a way that looks completely out of proportion to everyone watching her. And because she learned to hide all of it so well, by the time anyone is actually looking at her, all they see is a woman who seems fine, maybe a little particular, maybe a little sensitive. Nothing that looks like autism on paper. Can I ask you something? How old were you the first time you remember performing normal? Not lying exactly, just doing the version of yourself that felt safe to show, instead of the one that was actually going on in your head. I really want to know. Tell me in the comments, because I think a lot of women watching this are about to recognize that exact moment in themselves. A lot of women don't find any of this out until they take their own child to get evaluated. They're sitting in that office, listening to a doctor describe their child, and somewhere in the middle of it, they go completely still. Because the doctor isn't just describing the child anymore, the doctor is describing them. At 7 years old, at 15, right now, today, in this exact room, that moment changes something in a person. It's relief, because finally there's a name for something that never had one. But it's also grief, the kind that doesn't get talked about enough. Because now she has to sit with every single year she spent believing she was lazy, or too sensitive, or dramatic, or just not trying hard enough. She has to grieve the version of her life where someone caught this when she was 7 instead of 41. The version where she got real support instead of decades of quietly blaming herself for things that were never actually her fault. That grief is real. It deserves space. You do not have to rush past it just because you finally have an answer. So if any part of this sounds like you, here is what actually helps. I want to be specific because vague comfort doesn't change anything. If you suspect this about yourself, look for a clinician who specifically understands how ADHD and autism present in adult women. A lot of the standard screening tools were built around how boys present, so even a real evaluation can miss it completely if the clinician isn't familiar with the female pattern. It's worth asking directly whether they have experience with adult women before you ever book the appointment. Start writing things down before you go in. Specific memories, the eye contact you had to practice in the mirror, the meltdowns you only ever let yourself have in private, the hours you lost to one interest and the hours you couldn't survive doing something boring. Specific examples help a clinician see the actual pattern faster than a general feeling that something has always been off. Give yourself permission to need recovery time after being around people, even people you love. That is not you being antisocial. That is your nervous system finally asking for what it has needed the entire time. And start replacing the word lazy in your own head. Every time it shows up, ask yourself if the real word underneath it is actually exhausted, or overwhelmed, or undiagnosed. That one small shift in language changes how you treat yourself every single day going forward. Find other women who have actually been through this, even if it's only online. Hearing someone else describe the exact same loop you thought only happened inside your own head does something a pamphlet never will. It tells you that you were never broken. You were just unrecognized. None of this erases the years you spent not knowing. I'm not going to tell you it does, because that wouldn't be honest, but it does change the story you carry about who you are. You were never lazy. You were never too sensitive. You were never failing to try hard enough. You were running a brain that nobody ever gave you the instructions for, and you still found a way to function, to hold down a job, to raise a family, to build a whole life without the one piece of information that would have made all of it make sense. That isn't weakness. That took everything you had every single day for years. So if you're sitting here right now, finally putting language to something you felt your whole life, I want you to know you are not behind. You are not broken. You are simply seeing yourself clearly, maybe for the first time. And that matters more than how long it took to get here. I'll keep making videos like this one because I think a lot of women are out there carrying things they never had a name for. If that's you, stay around. I'll be here talking about it.